At the medical school, and I actually take care of patients. I do a lot of educational things, teaching students, teaching residents, interns, fellows, and mostly the patients are teaching me every day. But I'm really excited to be here today because there's somebody in this room who's going to make a difference. And we're going to talk about that as we move on, because I think you have some exciting times ahead, and I think it's a great privilege for me to be able to talk to you and for us to work together on this project. So, a lot of you have thought about medicine a little bit, and have considered maybe the idea of going into medicine. So I'm going to ask you to think about a few questions as we get started. Hard work. Something you're going to have to do. Hard work is necessary to enter a medical career, not even just being a doctor, but also in any of the allied health professions. Hard work is necessary. The question is, do you want a profession or do you want a job? Now think about what I mean by that for a second. You know, a lot of people have a job and they go to work and they do what they have to do and they come home at the end of the day and that's the end, okay? A profession means that you are committed. There's a long-standing commitment here to doing something special, to making a difference, to being somebody who can make a difference in someone else's life. The third question, can you feel pain when others suffer? One of the key things you got to think about was when you see a patient, or you see somebody coming to you for help, and they're in pain in one way or another, can you feel their pain? When somebody tells you they're hurting, can you feel that inside? If you can make a difference. I'll ask you the fourth one. Your goal to make money or to make a difference. Now, if you enter any medical field, you're going to be comfortable, you'll be able to take care of your family. But you can also do that by getting a lot of jobs and other things that you do. And I'm not diminishing the importance of any job. What I'm saying is, if you enter medicine, what you can do is you will be able to take care of your family, but you will also be able to make a difference at the end of the day. Okay? So that's something that's very special. Thinking about, at the end of the day, you look yourself in the mirror and say, have I made a difference in somebody else's lives today? That's what happens in many cases when you're in medicine, and that's really what's about fun. All right. Well, now, I know that they talked to you a little bit about the heart, and you know, there's this kind of fist-shaped structure that sits in the middle of your chest, because this is what I deal with every day. I deal with people's hearts and concerns about their hearts, and I know they showed you some pictures, and they talked to you about the different chambers of the heart and how the blood flows. But when you see a flat picture like this, it's kind of tough to really figure out what goes on. So what I thought I'd do is to bring up something on the web that really shows it in a little bit more of a dynamic way. And I want to make sure that you have a good understanding of what the heart's about before we get started talking about some of the things that are going to be important principles in terms of keeping people well. So let's see if we can get over here. There we go. So, man, you can get a headache looking at that thing. All that stuff going on there. How fast that's happening. But I think what we're going to do is we're going to slow this down a minute and think about what it is that we're seeing at each step along the way, so that it doesn't seem too confusing to you, because in fact, this is not too difficult to appreciate. So, let's start out at the beginning. See those two arrows coming in? One coming from the head up here, and one coming from the feet down here. Blood is going to start coming in from the head and from the feet. This blood is blue because it's not yet received oxygen from the lungs. It comes in from the body, and it passes through a valve called the tricuspid valve into the right side of the heart. So this was the right atrium. This is the right ventricle. The right ventricle receives that blood with very little oxygen. And now its job is to pass it up through what's called the pulmonary artery into the lungs. And up here in the lungs, that blood receives oxygen. Oxygen is necessary for all body cells to function properly. And the way it gets it is the blood passes through the lungs, and pretty soon it picks up that nice red oxygen, and now it returns it to the left side of the heart, the left atrium, and from there into the left ventricle, the main pumping chamber of the heart, right there. And from there, it's pumped out through the aorta into the body. And the process starts all over again. Okay? So once more, really quicker action now. Blood comes from the legs and from the head, the neck, into the right side of the heart, the right atrium, passes through this called the tricuspid valve, into the right ventricle, whose job it is to pass to pump blood out through the pulmonic valve into the lungs, where it picks up oxygen, and eventually comes back to the left atrium, where the blood is stored, and then passes through the mitral valve right here, little flaps of tissue called the mitral valve, and from there into the left ventricle, the main pumping chamber of the heart. Now it's got to go out to the body, and it's pumped out through what's called the aortic valve, these little flappers of tissue here, and into the body, where the process starts again. Okay? And finally, just to remind you that it doesn't go that slowly, but now, all of a sudden, it doesn't look so strange, does it? Because you just thought about the steps that are necessary as it goes through. Who votes for that flat picture, and who votes for this picture as being more graphic? Flat picture? This picture? Okay, we got a message. All right. So, that's the deal. So we'll stop that. Anybody want to start CPR now? We've stopped the heart. Okay? All right. There we go. Okay, let's close the tab. Okay, so let's go back to where we were. All right. Well, enough of my story for right now. I want to ask for your story. Anybody in this room have anybody in their family or a friend or somebody you know who had a heart attack or had to have a stent put into their heart? By the way, a stent is one of these deals where the artery of the heart, there's a blockage in the artery. These arteries give blood to the heart muscle. The heart's a muscle. It's a muscle like any other muscle in the body. Like every other muscle in the body, it needs blood flow. The way it gets blood flow is through these red channels called the coronary arteries. And sometimes those arteries get blocked, and we're going to talk about how that happens. But if anybody has a family member or a friend or somebody you know who got a stent, this is what happens. They put one of those, they pass a little tube up to the top of the leg into an artery. They numb it up first so it doesn't hurt. Sometimes it's also done through the artery in the wrist. And then using X-ray guidance, they pass this tube up to the heart. Think that's going to hurt? It doesn't hurt. A little bit of discomfort where they're numbing it up first, but after that, it doesn't hurt. Pass that tube up to the heart using X-ray guidance, and then the tube goes right down into one of these arteries. And so it comes the size of a thin piece of spaghetti. Yes?
Is it possible to make a mistake while doing that?
You bet it is. Is it possible to make a mistake? Absolutely. So you can put that thing in, it can go in the wrong place altogether. That's why you are right where you are, because you're at the beginning of your career to learn how to do it right. There's a long training process that teaches us how to do it the right way, so that by the time you get to the stage where I am, you can practically do it with your eyes closed. I never do it with my eyes closed, though, let me tell you. But you get to know how to do it, you get to know where it goes, how to get it there, and to make sure it gets there safely. Patient safety is number one. The first thing that they teach you in medical school, day number one. And I'm giving you advance notice so that when some of you come to medical school, you'll know, say, I remember they told me that. Rule number one, do no harm. You don't want to harm somebody who came to you for help, okay? So the first thing you got to do is you better know what you're doing so you're not going to hurt somebody who's come to you for help. Did you have a question?
Yes, what do you think will happen if instead of the stent going into the artery, it goes into the vein?
So what would happen if the stent went to the vein? Well, in that case, it wouldn't help the patient. It could potentially hurt the patient. So that's why you have to know exactly where to put it. And that's what our training process is about. In medical school, in internship and residency, when you're done with internship and residency, you become a cardiology fellow, which means you train for another 4 years. So let's see if we can think about this. So you work hard in high school, you get kind of on a track where you think you might enter something in the area of medicine. And then you work your rear end off and you go to college. And you go to college for 4 years. And then you say, this is interesting, maybe I want to do medicine. And then you work your rear end off and pretty soon you end up in medical school. And then you do that for 4 years. And then you do an internship, and then you do a residency for a couple of years. That's another 3 more years. And then you decide you want to be a cardiology specialist, and then that's another minimum 4 years.
So basically, you're going to be in school a whole nother 12
You're going to be in
14
school
years.
for a long time. On the other hand, if you develop chest pain later today, and you went to somebody, you'd rather go to someone who's done all that training than to go to Joe's garage, right? You want to make sure that you have somebody who knows what they're doing, okay? So anyway, let me tell you a second. So they pass this little tube up into the artery about the size of a thin piece of spaghetti, and then they blow up a balloon that helps to crush this blockage against the wall of the artery. And then there's like this mesh wire work that's blown up on top of the balloon. They take the balloon out and they leave the mesh wire work in. And then all of a sudden, blood can pass through this. You're not cured, but it sure helps. It helps your symptoms. And we're going to talk about this, but I want to get back to the question. Anybody in this room have anybody in their family or know somebody who had a heart attack or had to have a stent put in? Anybody? Tell me about it.
My uncle, he was, what was he doing? I think he was like playing the Wii or something. And then he had,
How old's your uncle?
he was like 46 or something.
46. I mean, it doesn't sound young to you, but 46 is a relatively young person to get in heart trouble. So what happened?
And he had a heart attack, and then he went to the hospital, and they had to do that. And then, like 2 days later, something came up. Now he's fine.
Wow. And he came home, and now he's fine. Interesting. We're going to talk in a few minutes about whether he's fine or not. And we'll discuss that, and I sure hope he's fine. But there's a lot more to being fine than coming home after the artery's been opening up and saying, hey, everything's great now.
Yeah, but they told him he couldn't, like, eat certain stuff. Like,
So he had to change his eating habits.
Mhm.
Did they tell him anything about exercise?
yeah.
He might have to exercise. Did they tell him anything about medicine that he might have to take?
I'm not sure.
Not sure about that. Okay. Anybody else have anybody in their family with? Yes, tell me about it.
My grandfather had to get a stent put in.
He had
It
never
was like 2 weeks ago.
Really?
Mm-hmm.
And when he had that stent put in, how old was your grandfather?
My grandfather's old. He's like 83.
83. How did he feel with that? Did it help him?
Yeah, it helped him. He already had recent heart trouble, so he already had a heart bypass. So it was kind of difficult.
So he's already had a bypass done. What they do when they do bypasses is they usually take some veins out of the leg, or they can even use some other arteries in the chest, and they attach one artery up here, and they attach the other end of it here, going past the area in the artery where it's blocked. And that's what's called a bypass. Okay? So it's another artery that the surgeon attaches here, and then just past the area where the artery is blocked. So that's a way to reroute blood flow. Does blood pass easier through an area where there's an obstruction, or does it pass through an area where it's more widely open? Right. Higher resistance reduces flow. Anybody ever taught you that before?
Yeah.
Exactly. So that's the concept. So when you put a bypass in, there's a lower resistance area for blood to flow and get to the rest of the heart muscle, so a person will not have pain. Now, these are two patients who had stents. Does anybody